And as the federal government is making efforts to curb the rising insecurity in the country, the Minister of Defense is concerned about the armed forces health system. Bashir Magashi spoke at the forum in Abuja, where he explained that it has become necessary to reform the system as part of a larger reform of the Ministry of Defense. Sifon Asian reports.
The Ministry of Defense and its parastatals are being reformed. The goal is to get the ministry, which also oversees the activities of the armed forces, to operate like the U.S. Pentagon, having a mix of military and civilian personnel working together in an integrated environment.
The care standard.
The reforms will also affect the armed forces health system.
When we are witnessing suboptimal performance of the armed forces health system, the armed forces health system is bedeviled with numerous challenges, necessitating the need to engage a consultant to carry out a comprehensive need assessment of the armed forces health system.
Part of the objective is to develop a world-class medical facility similar to the Walter Reed National Military Medical Center in the U.S.
Our vision really is for us to have a joint doctrines of synergy of the armed forces, where the Army, the Navy, and the Air Force have prompted the need for this reform of these medical services.
For the Chief of Defense Staff, the reform will also serve as a morale booster for troops and their families.
Critical to this moral component, of course, is healthcare, the emotional well-being of our personnel. That's the reason why it has become quite necessary and very compelling too for this project to kickstart. I believe that this project ought to have been yesterday.
Previous efforts to reform the Ministry of Defense did not sail through. Reforming the Ministry of Defense and indeed the defense health sector is no mean feat. What remains to be seen is how words will be matched with actions. Sifon Asian, TVC News, Abuja.